a recent article, physical therapy is just as effective as surgery for reducing pain and disability and degenerative disc disease. So what I wanted to do is extrapolate that a little bit and say, if it's as effective, what are some of the things that would make it effective? Well, first of all, you always want to get a thorough and individualized evaluation and treatment plan. But some of the things that I can somewhat generalize, and they are on the higher level scope of movement patterns, at least to show you a few things that can help stabilize your spine, because the more stable you are during movements of regular activities, such as picking something up, if you're stable through your spine, that'll help reduce your chance of getting surgery in the first place and lower your pain and disability or dysfunction that you may have. So a couple of those things are what we call the balance leg reach. And what it is you would stand on one leg, that leg's going to bend, you're going to reach back with your opposite leg. While you're doing that, you're going to tighten your abdominal muscles. Some people will even tighten their fists, so that creates a whole body stability. And then you would do about 3 to 5 of those each leg. And what's another thing we find important when someone's doing that, of course you want to do it nice and controlled at first. You can always add speed or even weights later once you get really stable and strong. You always want to compare your left and right. So if one side is really wobbly and the other side is very stable, you always want to make sure you do your better side first. And if that side that's bad, in a sense, if you just can't do it, or it's too much pain, or you just feel like you're going to fall down, it's unsafe, don't even do that side, only train one side. And by training that one side, it will actually help the opposite side that's not doing so great anyway. So those are a few stabilization movements that by doing those preventatively, even if you don't have any pain, you can lower your chances of pain and disability in the future. And if you are looking for surgery, by doing these, you'll avoid your surgery. Thank you.